Cardiac output is a measurement in milliliters per minute of the amount of blood pumped by each ventricle within that 1 minute time frame. Recall that the ventricles are fullest at the end of their diastole, when the atria have pumped blood into them, which is called the end diastolic volume, or the preload, and they are the emptiest immediately after the ventricles finish contracting during systole, which is called the end systolic volume. Knowing how full the ventricles were before contraction and how empty they are after contraction allows us to calculate the stroke volume, which is how much blood that they ejected. By taking the end diastolic volume and subtracting the end systolic volume, we obtain stroke volume. This value is typically about 70 milliliters per beat and can typically be measured using an echocardiogram. We obtained that number by taking the end diastolic volume of 120 milliliters per beat and subtracting the end systolic volume of 50 milliliters. 120 minus 50 gives us 70 milliliters per beat. So now that we know how to compute stroke volume, we can examine the equation for cardiac output. And cardiac output in milliliters per minute is equal to heart rate in beats per minute multiplied by the stroke volume in milliliters per beat. Since beats is in the numerator of the heart rate and the denominator of stroke volume as the units, the unit of beats will cancel out, leaving us with units of milliliters per minute for cardiac output. Taking the resting heart rate of 75 beats per minute and multiplying that by 70 milliliters per beat for the resting stroke volume, we obtain 5,250 milliliters per minute, or 5.25 liters per minute for cardiac output. So recall now how much blood volume a typical adult female and a typical adult male have. That volume is approximately 4 to 5 liters for an adult female and is approximately 5 to 6 liters for a typical healthy adult male. And this means that cardiac output, or at least resting cardiac output, the entire blood volume moves through the ventricles in a single minute. Cardiac output is a multiplication problem, so that means if one variable increases while the other variable remains the same, cardiac output will increase as a result of that. So when force of contraction increases, typically we see that stroke volume also increases as well, because when the heart contracts more forcefully, it ejects more blood with that contraction. And so that means that if stroke volume increases, cardiac output will also increase. An increase in heart rate with no corresponding change in stroke volume will also increase cardiac output. The major variables that will increase heart rate and force of contraction are decreases in blood volume and blood pressure, because if a person is hemorrhaging, typically that means their heart rate will increase in order to compensate for the loss of blood and maintain fairly normal, fairly typical cardiac output. Strong emotions from the limbic system in the temporal lobe of the cerebrum will tend to increase heart rate and force of contraction, because these are physical responses to emotion. Increased thyroid hormone concentrations in the blood, because increased hormone concentrations will increase heart rate, and we'll see later on that thyroid hormone does influence heart rate. Increases in body temperature, because as body temperature increases, the heart pumps more blood to the skin in an effort to cool the body. Increased nicotine and caffeine concentrations, because these are both stimulants that act on the heart, and then also increased epinephrine and norepinephrine concentrations in the blood that were released by the sympathetic nervous system. Both of these hormones increase heart rate. We see that drugs that are referred to as beta blockers will actually inhibit the beta receptors, which are the receptors that bind norepinephrine on the heart. And these drugs function to slow heart rate since the norepinephrine is unable to bind to its receptor and stimulate the heart. So that lowers heart rate, and in doing so lowers cardiac output and also helps lower blood pressure and things like that as well. Next, we'll examine some factors that decrease heart rate and force of contraction, the first of which is age. Heart rate naturally declines with increasing age. We also see that heart rate decreases with increases in blood volume and blood pressure. When thyroid hormone concentrations in the blood decrease, that will also work to decrease heart rate and force of contraction, and also lower body temperatures will decrease heart rate. Finally, we'll examine some factors that affect preload. So when the heart contracts more rapidly, that leaves less filling time between beats, which reduces the end diastolic volume or preload. Eventually, when the heart contracts so frequently, preload is decreased to the point where cardiac output does not increase, but instead it stays consistent. It is beating more rapidly, but it has less time to fill, and so if it has less preload going into when it ejects that blood, naturally it will eject less blood as a result of that.